Hello, everyone. I'm Sherry with the CGH Health Foundation, and welcome to our Growing Healthier Facebook Live program. We do these programs every month as a way to share important health information with you, and also gives you a chance to introduce you to some of our very good providers. Today's program, Dr. Bird's going to be talking to Dr. Young Song from CGH Urology, and also to Dr. Nancy Tran, who's one of the providers in our CGH Menopause and Women's Sexual Health Clinic. The topic today is sexual health for men and women, and we're going to learn how our body, mind, and hormones are connected in the science of sex and intimacy. And speaking of hormones, for all of you that attended last year's Hot Flash Bash, we're planning to do it again. And the date's going to be sometime in April. We don't have all of the details worked out, but please watch our Facebook page, the CGH Health Foundation Facebook page, for the information and make sure that you register well in advance. It sold out last year. We're still deep in the middle of February, and we did a lot of things to commemorate Heart Month this year. One of the things that we're doing is a weekly heart healthy video, and we put that post on Facebook on the CGH Health Foundation's Facebook page on Thursday mornings. And all you have to do is watch the video and then like and share it and comment on it. And we enter you in a drawing for this fun family activity package. So we posted one this morning if you want to go looking for that one. And then next week on Thursday will be the fourth and final one. So be watching for those video posts as well. Before I turn it back to Dr. Bird, let me tell you about next month's program. On Thursday, March 5th, we'll have Dr. Faizan Khan here. He's a gastroenterologist. That's hard to say. And he's going to be talking about some important developments in colorectal cancer detection and treatment. So make sure that you put that one on your calendar. That's Thursday, March 5th. And I think Dr. Bird's waiting out there.
Hi, Sherry.
Hello.
Thank you for the lead in. I appreciate it.
You're welcome.
Okay. All right. Hi, I'm Bill Bird, Chief Medical Officer here at CGH Medical Center. Thank you for taking the time to watch our Facebook Live episode today. Yeah, and today's topic is sexual health for men and women. Looking forward to this. I thought I was giving our marketing department a hard time. I thought they could come up with a sexier lead-in song, but we'll take our normal for this one. Anyhow, sex is a difficult topic. It's a difficult topic to talk about. I know when I was practicing in primary care, a lot of patients would take a long time, maybe multiple visits before the conversation that they wanted to talk about in terms of sex and sexual health would come up. And it's a tough topic. So I'm so glad that we're able to talk about it here today with Dr. Song and Dr. Tran. Welcome, Dr. Song. Welcome, Dr. Tran.
Hi.
Great to have you. I guess the first question that I have is for Dr. Tran, and it's this. I think there's a conception that a lot of people have that patients don't want to talk about sex. What would you say? Is that a myth or is that the truth, Dr. Tran?
Thanks, Dr. Bird. So they actually did studies on this and surveys, and what they found is 85% of men and women want to talk to their clinicians about their sexual health. So they believe that 94% states that their sexual enjoyment is very important to their lives. So about 90% of patients prefer, however, that we initiate the topic. So I think a lot of providers don't bring it up because they're either uncomfortable about it or because the patients aren't asking. But in truth, the patient actually, a lot of times they feel uncomfortable initiating the conversation. So it's not the same in my clinic because that's what I do, but I think in primary care, it may be an issue. So we also know that sexual dysfunction decreases quality of life. It increases depression and also lowers self-image. What we also found that women with hyposexual disorder, people with low desire are 8 to 10 times more likely than women with normal desire to feeling unhappy. They're getting more disappointed, frustrated, ashamed, and also bitter. and that the loss of sexual desire has the same quality of life burdens, such as someone with chronic disease like diabetes and back pain. Something that we really don't think about, because we talk a lot about back pain, we talk about chronic diseases, but the loss of sexual desire does have problems there too. And we also know that it affects relationships a lot. So when sex is good, studies have found that it adds 15 to 20% additional value to that relationship. But when it is bad or non-existent, it decreases the positive value by 50 to 70%. So it is a huge thing. And I did mention that low sexual desire negatively affect your self-image and also your partner relationships. So it can decrease your body image by about 70%, decrease your self-confidence by about 50%, and also your self-worth, 30%. And it decreases connectedness with your partners, significant less in communication, and about 35% of the partners will worry that they will cheat on them just because they have low sexual desire.
Yeah. Wow, that is a lot of information really quickly, Dr. Tran. But nonetheless, very helpful. Yeah, that's some really powerful stuff in terms of the research that's been done and the information that's out there. I will say that it seems like there's more that's known and discussed about like male sexual function. We don't typically discuss as much women's sexual dysfunction. I guess the follow-up question to some of that data is that because it's rare?
So for female sexual dysfunction, I know there's a lot of talk about male sexual dysfunction, right? Especially about like erectile dysfunction and all that. And pretty much everyone knows about that. But for female, it's not as uncommon. So to actually be a dysfunction, it has to cause significant stress, right? So it's not just because they have a low libido or a decreased orgasm. Sometimes you just have to have a lot of difficulty there to call it a dysfunction. So usually it requires a minimum of 3 months or usually 6 months. And then we take a look at that. We say, is it lifelong? Is it acquired? Is it a generalized issue? Is it something that's just situational? And then we also have to make sure that it's not caused by depression, some type of medical condition, or chronic alcohol usage before we call it a dysfunction. And I usually like to break it down into 4 parts. So female sexual dysfunction, I look at the desire, which I briefly mentioned already, the hyposexual desire disorder. Then I look at, is it an arousal issue? Is it an orgasm issue? Or is it a genital vaginal pain issue? So again, they did studies on this also, and they said about 44% of women reports any type of sexual problem. So this is not a dysfunction, just any type of sexual problem. And you break down that most of it is a low desire. And then of course, a certain percentage will be an arousal issue and then an orgasm issue. But if you actually say, is it an actual dysfunction where it's causing significant distress, the numbers actually drop down to 12%. Again, the same category, the most of them is a desire issue and then arousal issue and then an orgasm issue. And most of these problems occur in the perimenopausal early menopause phase around 45 to 65. So it's not that women after 65 are not having sexual problems, they are, but then it's not considered dysfunction because for whatever reason, women over 65 aren't as distressed. So they may have sexual problems, but they are not distressed. So we don't call it a dysfunction after that.
Okay. All right. Wow. Good information. I wanted to shift gears and talk about male's sexual function. So Dr. Song, as a urologist, I'm going to give the floor to you to talk about that some, because I know that that's something that's a passion of yours as well.
Okay, well, thank you so much, Dr. Bird. Thank you, Dr. Tran. That was so informative. And I love that we can talk together, because when I talk about this in the clinic, it's usually just, we talk about the male sexual dysfunction. And majority of the time it's erectile dysfunction, that, difficulty with erections, but there's also premature ejaculation. There's delayed ejaculation, there's priapism, there's Peyronie's. So there are some other, there's even anhedonia of ejaculation, which would be very sad, no pleasure with orgasm and ejaculation. And then there's painful ejaculation, and even with some of our side effects with our medications, tamsulosin, you can have retrograde ejaculation. So there's erectile dysfunction, and then there's ejaculatory dysfunction. and for women, you said you broke it down to like arousal, desire, pain, and orgasm. But men, I guess, have it more like ejaculatory or erectile, or desire is also, I guess, part of our conversation too. And that's where we talk about testosterone and the lower libido, or lower energy, etc. So we talk about low testosterone and how that can improve your desire, but not necessarily improve your erections. And so it's a great conversation to have with your partner in the office. So I think I would love to, like, I know that some of my patients, their wives go to Dr. Tran's or Dr. Jones's menopause clinic. So it would be, I just thought it would be great for like both clinics to have a conversation together. So if your partner is coming to talk to the urology department for erectile dysfunction and you have a female partner coming to the menopause clinic, it's good for both partners to come and talk together.
Maybe we should have a clinic. Maybe we should have a clinic with both of you together with both partners.
I know. I know.
Now that would be something. Yeah.
Right. Because I feel like sometimes I'm only seeing half of the, I don't want to say problem, but mostly half of the situation, because it's such a complementary discussion, and it takes both partners to figure out like how to help the situation. So so I find that this conversation with Dr. Tran and Dr. Jones, or any kind of complementary like female sexual health, would be very beneficial to talk with when you're talking about male erectile dysfunction. And I always think about the wives too, or their partners, because when a man comes in with erectile dysfunction, a lot of times women might think that, just like Dr. Tran had said, like maybe he's cheating on me, maybe he's not interested, or maybe he doesn't find me attractive. And I find that is like the farthest thing from the truth. I just feel that it's hard for guys to talk about it with their wives, but it's not because they don't love them or they're not interested. In fact, they're very much in love with them and they want to have sex, but they just can't. And so then it kind of discourages them to either try or to have that intimacy. So I was actually also interested in the conversation about there's treatment for erectile dysfunction and priorities, but it doesn't mean that every patient is going to have success with that treatment. So when we think about sex, generally we think about just like an erect penis, but I was thinking the conversation should also turn to like, what kind of sex can you have when you don't have an erection? What kind of like change of mindset can you have? Because a lot of the truth is like erectile dysfunction is so common. And of course, all women are going to go through perimenopause and menopause, that their desire can drop. So how can we have it like kind of think outside the box and not just think you must have an erect penis to have sex or intimacy? So I was actually, just a side note. So
that could be a side note. You're good at those, Dr. Song. We'll let you go.
So I have children, and they ask me like, what's sex, right? So I thought, I should look into how to describe this for like a younger audience. So I saw this book. It was great. Basically, they described it as like the word play. Like when you think about play, it doesn't mean you're doing something specific. Play could mean like drawing or music or sports, etc. So I think of that too. Like, I think that's a great analogy for sex. Like when you think about sex, like it's not always just one thing. It's like, you can think of sex as like many things, like just, and not be specifically just tied just to the erection. And so, so I feel like there are men in my clinic that I kind of, put in certain categories, like men that have accepted that they have erectile dysfunction. And then they're just kind of moving on, like, well, if I can't have an erection, like how can I have intimacy with my partner? And then there are men that that do all the treatments for erectile dysfunction. And so I just think that term, the whole idea of sex, should be broadened, and that it should be kind of like the word play, where you have many things that you can think about, and not just one thing where it's just based on a erect penis.
Yeah, well said. And before I go any further, I was just struck by this. Our viewers don't realize this, but I would say that my experience with Dr. Tran and Dr. Song is that like, this is where they professionally have really taken off in the last several years, because I mean, Dr. Tran was a hospitalist, and I don't think that was a big part of your hospitalist practice to talk about sex.
No.
And Dr. Song, I get it as a urologist, that's your world, as erectile dysfunction, but not to what you're talking about there. When you kind of go down that realm of, well, you can have sex if you're not having if you don't have an erection, and it's play and some of those things. I think that's where Dr. Song also has learned a lot in her practice and outside of her practice. And so I think we are, I feel very, when I hear them talking about this, it makes me feel real good about our medical staff, and particularly the two of you, how you've gone outside of what your, in some ways, what your training was to learn more things for patients. So even before we get to the end of our conversation, thank you for what you're doing, because this isn't like a typical conversation that a urologist would have, or Dr. Tran's an internist, or an internist would have with patients. So thank you, and you're doing really good work.
Thank you, Dr. Bird.
Yeah.
Thanks.
Yeah. So I didn't want to forget it, because I would normally say it at the end, but knowing me, I'd forget to say it. So I wanted to say it now. Dr. Tran, let me go back to you here. One of the things you said is that for women, the most common thing is desire. Can you talk a little bit more about that?
Sure. So I did talk about HSDD, which is the hypoactive sexual desire dysfunction, and that is the most common sexual dysfunction that females have. So I like to first define desire. So I Google it and search, what does desire mean? So basically, a powerful, conscious, and often emotional mental state characterized by a longing or craving to obtain a specific object, outcome, or experience believed to bring pleasure or satisfaction. So when you have a dysfunction, what is the actual definition? So first of all, it has to be a minimum of 6 months, characterized by one of the two. So you either have lack of motivation for sexual activity, either you have reduced or absent spontaneous desire, or reduced or absent responsive desire. So we try to distinguish those two. And the second one is loss of desire to initiate or participate in sexual activity. And it also includes avoidance of situations that could lead to sexual activity. And it's not because of pain. So a lot of women might have vaginal discomfort, vaginal pain with penetrative sex, and it cannot be because of pain. So it's just no pain, but you just don't have that desire to have sex. And for any of these, you have to have clinical personal distress. So a lot of people will have low libido, and just because you have low libido, you're not diagnosed with HSDD. You have to feel that there's something wrong with you, and it's a problem, and then you can get diagnosed with HSDD. And when I talk to my patients, a lot of my patients will have low libido. They may not have HSDD. I always talk to them about the biopsychosocial aspects. So because it's very complex, it's not just about hormones, it's about everything else that's happening in their life. So the biology part will be like, maybe they have GSM, so maybe it hurts to have sex, so they don't want to have sex. Or maybe they're very tired because they're not sleeping well, so you have to like deal with that. Or they might have some other issues. Or maybe they're on an antidepressant that can cause low libido. So you got to rule all those things out. And then you talk about the psychosocial part, what is their religious beliefs, societal taboos, all of that. And if they have anxiety, stress, is it a self-image problem? We talked about self-image is causing low libido, but low libido can also cause low self-image. So which one happens first? And make sure it's not alcohol or any substance abuse related. And of course, the most important thing is, what is their relationship with their spouse? What is going on there? So with desire issues, I always believe that a lot of times sex therapy becomes really important. A lot of people don't want to engage in sex therapy. A lot of people just don't want to do therapy in general. So I usually just recommend reading certain books to kind of learn about themselves and figuring out what else is going on besides it's a hormone issue, and then work on that with them.
Okay. So two things there. So what does sex therapy look like, Dr. Tran, when you say that?
So there are licensed sex therapists, and we do have a link available. It's www.asect.org. And what they usually do is talk to the patient. I think the best way to have it is to talk to both partners, the male and the female, to really figure out. And they try to figure out what is going on with their sex life and go into more detail. Because I'm not an expert in that way, and I don't really have that expertise or that time to really delve into these weekly sessions that they might have. You can do that online, or you can do that in person. So I do know that our therapists here at CGH do some sex therapy. They may not be licensed as a sex therapist, but I know they do that too. But if you are interested in getting an actual licensed sex therapist, I would recommend going on that website.
Okay. And the other question for either one of you, Dr. Tran, you mentioned books. What books or reading would, for those who are watching this and are interested in learning more themselves, would you recommend?
So I recommend all my patients that have any libido issues, Dr. Kelly Casperson's book, You Are Not Broken. So that one talks about a lot about women's sexuality, some part of menopause. So that is highly recommended. She also has a podcast. She's a female urologist, and she really ventures into the world of female sexual health. So I recommend that book to every patient. Dr. Song, do you want to talk about the other two books that you had recommended?
Sure. I recommend like my male counterparts to read this too. The one is Come As You Are, and then the other one is The Menopause Moment. Also really good for both partners, just to realize what's going on with each person. So yeah, I think just talking about it together, and like Kelly Casperson, she's a urologist, and she she's the first person that brought up the topic female sexual health that I like was introduced to. So I think she's really an expert in her field.
Yeah. And Dr. Song, and actually you and I actually had a Facebook Live about the Come As You Are book. I don't know, a year or two ago. So yeah, that was a really, I read that book, very interesting book, very helpful for me to understand.
Yes.
For the standpoint of my wife and what she was has been going through in terms of menopause and those type of things. So, yeah, very good. I just practically speaking, I wanted to ask both of you, like in terms of the type of patients that you see in your clinics who have sexual dysfunction, both men and women. Can the two of you speak to that?
Sure. I feel like we share patients, Nancy and I. She'll be like, your husband should go see Dr. Song. And like, if your wife going to a menopause clinic, that's how we are. So anyways, I think that the desire mismatch, I feel like that's something that we could talk about together, because sometimes I have patients that are males that have higher desire than their female partners. Because that's what Dr. Tran was talking about, the arousal aspect of it, or desire part of it. But then I also have males that have lower desire than their female counterparts too, because maybe Dr. Tran has been fixing them too much.
You got to get that all synced up, right? You know.
Yeah. So what I'm saying is that both.
Do you ever call Dr. Tran and say, "Can you lower the dose a little bit there?"
So I think that for me in the clinic, I see a lot of desire mismatch. And I think that book also, Dr. Bird and I, we talked about there's spontaneous desire, and then there's responsive desire, and just like getting some language between the partners about it and understanding. I think that's kind of what I see a lot in clinic, the desire mismatch. What about you, Dr.?
Yeah, so I would say a majority of my patients come in. I mean, they're coming into menopause sexual health, and a lot of times during menopause, a lot of people have low libido, that they might not have an actual diagnosis, but just low libido, probably from lack of estrogen. So a lot of times when I treat them with estrogen, their sex drive does come back. May not be back to when they were in their 20s, but something that is acceptable. And I always have to talk to them about responsive desire, because a lot of women are hoping that they get that spontaneous desire where they're like thinking about sex and wanting to have sex and all of that. And I said, that may never come back, that you want to think about sex all the time. But it's okay, because it's, if you are able to have that responsive desire, if your spouse wants sex and you say, okay, and then you enjoy it, that is okay, because that's considered responsive desire. And that is good enough, rather than trying to find every reason not to have sex, or you're doing it and just not enjoying it at all. So I kind of have to explain to them that the responsive desire may be the best
Kind of
that they can get.
reframing expectations, if you will.
Pardon me?
Kind of maybe like reframing expectations.
Correct, managing their expectations, correct. So, but I do occasionally have patients that get their desire back, and they're like, well, now my spouse doesn't want to have sex, or they haven't want to have sex. So I would recommend them going to see urology. And I don't know, I think it's very difficult for men to go seek kind of care for their issues, because a lot of the women will say, well, he doesn't want to talk to anyone. He doesn't, like, he's just shut down. So I don't know if it's a erectile dysfunction issue there, or if it's more of a desire issue where it's a low testosterone issue. So so it would be nice for that partner to be there with you. Rarely, I probably have a handful of patients that come in and their spouse come in, and I'm really happy when their spouse come in, because it's nicer to talk to both of them about, to kind of manage her expectations and his expectations. So it's really nice to have both. So if, the visits can have both, that would be great. And I think, Dr. Song, I think you feel the same way, right?
Right. Mm-hmm.
Okay.
Yeah. Oh, and so another thing that I mean, of course, like, we just like to share our knowledge too, but something that I remember I learned in residency that always stuck with me was, so when a man has an erection, it's, then they go through ejaculation and orgasm, but you actually don't have to always have an erection to have an orgasm. So I just wanted to explain that, there's three parts, and they're controlled by three different nerves. Like the parasympathetic is for erection, the sympathetic is for ejaculation, and like more the autonomic is for the orgasm. So even like for males, like to shy away from sexual activity because they just cannot have an erection, they may be missing out on other experiences with orgasm, even without an erection. So it is known to have that without the erection. So that's sometimes some guys tell me, oh yeah, you know what, I figured that out. Patients will tell me, or some patients will be very surprised to hear that, because they always link all three together. Yeah. And so sometimes you can actually have them one without the other.
Okay. Yeah, very good. Well, we're getting close to the end of our time here, but I did want to, last question for both of you. What message would you want to leave with those who have been watching this broadcast?
From my perspective, I would want people to know that sexual dysfunction is very common, not just in men, but in women. And it's okay to have it, okay to talk about it. And that sexual health is very important to healthy relationships. And if you come in and you bring your partner, that's even better.
Yeah, I would say that a couple of things. So I would say that you should love the body that you have. There are a lot of times, like, I think with like the pornography industry, I think some men think that, I just don't know what they're thinking, but like, I think that you should love the body that you have, whether is very healthy or not healthy, because that's the one body you have and you want to take care of it. So it could always be worse. That's like the bright, you should just just love the body that you have, regardless of whether, what you think of it. And then I think that it's very important for couples to talk about what their issues are. There's no way to solve the problem. And there's no way for the other person to understand. So not only should you talk about it, but, of course you should also listen to the other partner. And so I think that sometimes I feel like I only hear a one-way conversation, with my patients, because the other partner is not there. So I feel like talking about these issues are really important. So loving your own body, and then encouraging each other, like, in terms of the couples, because obviously it's just like another area that each couple can support each other. When you find, like, if I needed hearing aids, my spouse would help me get hearing aids. It's just kind of one of those things, like it's part of your health.
I
And
like
then,
that. I like that.
yeah. And then another thing I wanted to say is normal. Like, people are really hung up on what's normal. And I feel like as I'm listening to all my patients and being here in the clinic for now like over 10 years, I feel like there's really not a normal. And I think what's normal between the couple, like what, you and your partner make normal, that's the normal that you should seek for. Like, and you shouldn't, like, social media or whatever, the like social culture, like there is no normal like that you should be outside of who you are and what yourself. Like, yes, there are like statistics about like how long it takes to have, how long on average. There are statistics out there like that. But what I'm saying is that
It's okay. Take your time. Yeah.
no, like people want to know, like, how often should I have sex, or what's the normal, that kind of thing. And it's like, it really depends on like the couple. And then each couple actually also goes through seasons of like high activity and low activity because of what's happening in their life. And so I feel like when people look for what's normal, they should just look within themselves, look to each other and just figure out what's best, what works best for them.
Yeah. Great. Well, hey, from my perspective, this has been a marvelous conversation. And I thank both of you for taking that. You reached out to me. You both wanted to do this. So I thank you for doing that, because I think this is really important stuff to be talking about. And for those who are watching this, there are some resources that our marketing department will put up in terms of those books and other links of things that folks can look into on their own. But I also would say that, Dr. Song actually practices here in Sterling and sees patients and does this kind of work on a daily basis. And Dr. Tran and Dr. Jones, who's your partner at the Menopause Clinic, see patients on a regular basis here in Sterling, and are ready to have you come in and talk about these things that we were talking about right now. So thank you so much to both of you. And for those who are watching this, I really encourage you, if you find this helpful, of course, to make appointments and see Dr. Tran, Dr. Jones, or Dr. Song, but also just to share this with others so they get a chance to get a sense of what's out there and what's possible for them in their relationships. So, ladies, thanks again, and great to have you.
Thank you, Dr. Bird.
Okay, so what I wanted to do before we close out here together is just highlight some of our employees here at CGH and some of the great work that they do. So I first wanted to mention Amanda Fries, who works in our Human Resources Department, and she was our December Employee of the Month. We haven't had a chance to do a shout out for her. Abby House, and she is our January Employee of the Month. She works in Patient Access. And finally, Emily Schultz, and Emily works in our Diagnostic Imaging Department, radiology, for those of you who don't know what that is. And so she is active and a supervisor in that department and is our February Employee of the Month. So congratulations and thanks to all of those employees. And then a Daisy Award for Extraordinary Nursing to Judy Capitelli. My apologies. And do we have anyone else? Yes, Kinsey Williams, a CNA in our emergency department, received the Sunshine Award for outstanding care done by CNAs and MAs here at CGH. And once again, Sherry talked about this, but next month we're going to talk about innovations in colorectal cancer, both detection as well as treatment. So looking forward to talking with Dr. Khan about that issue. I think that about covers it. Thank you for taking the time to watch this broadcast. And until next time, thank you for watching. This is Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. Thanks.